Hey everybody, it's Kevin Kane, healthcare organizer at Citizen Action of Wisconsin. I just wanted to let you know that today is a very, very important day in the world of healthcare reform. Today, August 1st, is the day when a large number of preventive services kick in for insurance companies that have to cover individuals. And a lot of it really comes down to the benefits for women. So I'm going to tell you guys all the great news that is happening there. First off, though, I want to let you know why I'm a little bit more dressed up than normal. Citizen Action is going off tonight and doing a public presentation, talking at a public forum about healthcare reform. If you want us to go do the same, feel free to check out our Got Healthcare website, our Citizen Action website, and then you can invite us to come and present anywhere you want. We will go anywhere, explain healthcare reform, and how to talk about it moving forward. So this is great news first and foremost for what's going on today, the very, very big news. Today, August 1st, it's going to make being a woman a lot easier when purchasing health insurance. And it's really about time that women have had somebody on their side with all this. With the passage of the healthcare reform law, the Affordable Care Act, women finally have relief from an insurance company that has really been profiting off making women pay more than men. Politicians, many in the pockets of big insurance companies, are trying to allow insurance companies to continue profiting off them, ending protections like pre-existing condition discrimination, allowing insurance companies to do that once again, ending a wide range of preventative services that kick in, such as mammograms for women, colonoscopies, these kind of preventative services with no co-pays, no deductibles, no out-of-pocket costs, making sure that if you want to be healthy, go to your healthcare professional to get the care that you need. And additionally, the Affordable Care Act actually makes it so women will no longer pay more for health insurance than men. Right now, women are much more of what you refer to as an actuarial risk. You're a riskier person to insurance companies if you're female. And so, because of which, oftentimes women are charged more in the majority of states. But moving forward, thanks to the healthcare law, women cannot be charged more than their male counterpart just because what chromosome they happen to have been born with. So I mentioned some of the benefits that are taking place today. Here's what's changed. For all new insurance plans that take place after today, they'll now have to include well women visits, breastfeeding support, supplies, and counseling, contraceptive methods, counseling, screenings and counseling for domestic partner violence, screenings for gestational diabetes, counseling for sexually transmitted infections, including HIV, screenings for HIV, and DNA testing for high-risk strains of HPV. All these different things, whether they be some sort of preventive care, things like birth control, or making sure that you're healthy long-term, will be covered now by all insurance plans that start after today. This is fantastic news. This is going to go a long way to making sure more women have more security and control over their lives. They don't have to wonder about how they're going to be able to pay for these, in many cases, preventive care. Things that just help them, live life and make sure that they're living healthy and well. And so this is going to go a long way, again, to making sure that people have more control over their lives and they can get the care they need. Because we all know prevention saves money and it keeps us healthier. So I want everyone to remember that these protections, these new benefits are very important. They've been proven by studies to be not only life-saving, but actually reduce money long-term. Because every single person knows preventive care saves money. We got to make sure people don't get really sick and thus run up the hospital bills. So this is fantastic news today about the benefit for women all across the country. Be sure to check this out. Again, Kevin Kane and Citizen Action, thank you guys so much. We'll keep you up to date in terms of many more opportunities to hear how to message healthcare in our online messaging bootcamp. Be sure to share this video if you get the chance, and by the way, comment at the bottom so we have other ideas of what else to present. We want to make sure you tell us what you want us to tell you about. We know how to message it from now till November and beyond. So thank you guys very much.